So basically, I got these sealants put on when I was really young, thinking that they were a preventative measure to keep my teeth from getting rotted or anything in there. And I'm 20 years old now, and I go to the dentist, and they say I need 7 to 9 root canals, all which need to be crowned. At 20 years old, I mean, you'd expect a 70-year-old to get their teeth pulled and have dentures, but not a 20-year-old.
And so one of the interesting things is, as a patient, it seems like a crazy thing to be told to you, but you have to understand that when we look at your x-rays, even though to an outside glance the teeth look like little tiny cavities, inside, because of the way teeth are decaying now, they're different than the old days. Because of the fluoride, the outside of the tooth seems hard, but the inside is rotting out. So to you, your teeth feel pretty good.
Yeah.
No pain. They don't even have any cavities in them, but inside they're rotting out, and that's part of what's happening with fluoride. And so what the rules are for dental procedures is that whenever we have a cavity, based on a doctor named G.V. Black, we need to remove all of the decay. And in your case, removing all of the decay means we're going to run into the nerve of the tooth and then have to do root canals on almost all of your back teeth. And because that's financially not something that you can do, you're talking about taking out all of your back teeth. But these rules that were established back in 1890 for removing all of the decay, those are really outdated now. We can do a technique called the modified Hall technique, where we go in and remove most of the decay and remove all the decay on the outside of the tooth, but leave a little bit of the decay right over the nerve of the tooth. And then that area of decayed tooth is nourished and hardened and sterilized from the inside out. The circulatory system of the tooth feeds that area, and in 6 months it's hard and strong and forms an insulation.
Whoa.
So it's like nature's medicine. And if we can just leave those pulps undisturbed, the nerves undisturbed, there's a 95% chance that those teeth won't need root canals. Now there's a lot of decayed teeth, and there may be 1 or 2 teeth that eventually may need a root canal. And I may not be 100% successful. We may end up running into the nerve of the tooth and have to do a root canal. But this new technique, which is only taught in a few of the dental schools, is going to be a huge advantage for you, because it's going to be the difference between having 8 root canals and even if we do endodontic therapy, we don't necessarily want to put crowns on these teeth, because crowns are going to remove 70% of the volume of the tooth. Yeah. So if we follow the old-fashioned rules of dentistry, which are still taught in most dental schools, that's the right treatment for you. But that's not the right treatment for you.
Yeah. Yeah.
And it's not something I want for myself or one of my children, but it's the problem is dentistry, it takes a long time to catch up to some of these advances. So I'm real happy that we're going to be able to provide something that's a pretty big deal, because there's so many teeth. It's your whole mouth.
Yeah.
Yeah.
So this is a pretty special case. I feel very blessed that we're going to be able to do this for you today. How do you feel this morning?
Extremely nervous, honestly.
Yeah, that's normal. All right, Lauren, good morning.
Morning.
It's been about, what, 8, 9, 10 hours since you were in the chair?
Yep.
We spent most of the day yesterday together.
Yeah.
So tell me how your teeth felt last night after doing 12 very, very deep decay removal restorations.
Last night, all I felt was numb, but when I woke up this morning, I had no pain whatsoever.
So you have no pain with your teeth?
None.
Zero?
Zero.
Zero?
Zero.
Okay, how about putting cold on your teeth?
No, I don't feel any pain with that. I just drank some water this morning and it worked out just fine.